I am going to be trying to talk to you today about, this afternoon, about why is mobility for older persons important. I want to talk to you about what I call destination transportation. I also want to talk to you about levels of support that are needed. And these are all things that I want you to consider as engineers. What needs to go into those algorithms? What needs to go into your technology? I want to talk about the impact of dementia on transportation options. I also want to talk to you about a colleague, Helen Kirshner, who developed the 5 A's of age-friendly and dementia-friendly supportive transportation. This is a real easy way of being able to think about transportation programs. And then just give you a little bit about my own research on technology and community transit, and also some things to be considering about policy. There we go. So here's the larger question. Can you get to where you want to go when you want to go there? So some people, I heard this phrased by a colleague many years ago, is that people want to live a spontaneous life, meaning that you might get up in the morning, you might decide that you're going to class, but maybe then you're going to stop and get a bite to eat. Maybe you need to do an errand, and all these other kinds of things that you're thinking about what you're going to do during the day. Now that's in transportation, we call that trip chaining, one to the next. But when you think about if you have to depend on another person or an option, and you need to be able to say, okay, I want to go here, then I want to go there, or I don't even know if I want to go there yet. Maybe I don't decide until later. You're not able to do that. And then if you're an older person and you're using a program that you have to do advanced scheduling, how do you know, like next week or 2 or 3 days from now, aside from doctor's appointments or other kinds of appointments? And actually the thing about doctor's appointments, you need to know what you've got your doctor's, you know that you have to have a follow-up appointment with the doctor. You need to arrange your transportation, make sure that all that is going to mesh. Think of this cognitive load that people are under. I also want to point out to you that the woman in the lower picture, again, she's not wearing a seatbelt. Why is it that all these pictures of what I was told are Korean people, older people in transportation, and they're not wearing seatbelts? So we have to do something about that. But I was told about this particular woman, and there was an article in the paper that, she finally passed her driver's test after taking the test over 900 times. Now, what's wrong with that? You would think after the second or the third time that maybe she would be referred to other options. So that was a concern there. So where do people travel? And this is where I'm thinking about destination travel. Now, I have created this way of thinking by using Maslow's hierarchy of needs, survival, maintenance, and enhancement. But what I'm calling it are life-sustaining transportation, life-maintaining transportation, life-enriching transportation. And these are just examples of the kind of places we go to that might fall under one of these categories. And you might have transportation available, but it might only, a lot of programs that provide transportation, community transit, will provide what they call essential transportation. Well, I want to suggest to you that quality of life transportation, life enriching, is essential, is important to people. But to what extent are those kind of needs being met? So as a gerontologist, as somebody who thinks about the total picture of daily life for an older person, I want to make sure that we're trying to have ways, methods that all these types of destinations needs are being met. So this is a table that was developed by John Burkhart many, many years ago. And we, my colleagues Helen and myself, we took his table, we adapted it a little bit and put it into our textbook on senior-friendly transportation. And when you look at this continuum, it shows the type of transportation, like, you know, if you're going to, do you have to walk to a transit stop in order to be able to catch a bus? Or does the transportation need to come to you? And also, Jenny had mentioned that we have volunteer transportation programs in the United States. We don't have as many as we should, but that seems, excuse me. Volunteer transportation programs seem to be the ones that are able to do that kind of stay at the destination or door-through-door kind of transportation, which I'll explain in a bit. So what I've been able to find about paratransit in South Korea is that your paratransit, which is specialized transportation, you know, I don't know if this is accurate, provides one vehicle for every 100 people with disabilities in cities with less than 100,000 people. And people, you know, does that seem right to you? And that one vehicle for every 150 people with disabilities in bigger cities. And that these services use these vehicles with, you know, wheelchair lifts and offer both shuttle routes and on-call rides. Now, in the United States, it's like you're required to have paratransit within 1.5 miles of a fixed bus route. And that means only where buses exist. So if you're in a rural area and there's no bus, they're not required to be able to provide that kind of paratransit. So we have certainly issues, limitations there. But it seems that you have those similar limitations here as well. So how do we start thinking about levels of support that are needed? So there's gentle support, opening doors and providing verbal guidance. And as I'm mentioning these types of levels of support, think in terms of like where you're at now in terms of autonomous vehicles and to the extent to which the autonomous vehicle really addresses these levels of support. The door-to-door gentle support might be door-to-door assistance where the passenger assistance is provided to and from the entryway of the pickup and drop-off destination by a driver or a transportation escort. When you think about the taxi cab, it's curb-to-curb transportation, okay? You have to get to the curb and the cab is meeting you at the curb. So this is door-to-door that you're actually meeting the person at their door. Physical support. Maybe the individual needs assistance with balance. Maybe needs assistance in climbing steps or performing similar functions. It may include delivering the rider, the passenger, to an attendant at the destination who then takes over the task of personal support and assistance. And that's called hand-to-hand or chair-to-chair service. We think in terms of the chair in your home to the chair in the doctor's office. You know, it's like just dropping that individual off at the curb. That person might not make it into the office. All right, so, you know, think in terms of physical support. Activity support. The driver or the escort stays with the rider and helps with the activity at the destination. For example, they may assist the individual in a grocery store. They may help the rider understand a doctor's instructions or diagnosis. There was a really nice model program in Massachusetts, which was medical advocates, transportation, the volunteer with signed waivers and everything from the family and from the individual. The volunteer would pick the person up, take the person to a medical appointment, actually go in with the individual to see the doctor, take notes, be able to report back to the family or to the social worker at the agency what was said, what was communicated. Then take the individual home, but maybe that individual needed to stop and pick up a prescription. They would be able to stop at the pharmacy and be able to do that. But that was all an organized volunteer transportation program. That's not something that's like readily available to people, but you could see how that type, if a family member is not available to go with you, and particularly where family members are more geographically distant, just not able to do that, or that you're not, or you're working or just not available, to have that kind of program is very helpful. So that's called stay at the destination. Personal support, the driver or escort. So I also have this idea of like, well, maybe we need monitors, somebody to assist. So it's not necessarily the driver. Let's say the driver has a van and then there's 10 people. You're not able to like leave the van and go and to help the person to the door, but maybe if there was a volunteer monitor or maybe or somebody or a part-time or a staff person that actually could assist, like on a van or something to take someone. And maybe, but that in the personal support, maybe you need assistance putting on your coat or your shoes or your boots, putting away groceries, taking groceries in from the van into the house. So that's called door-through-door transportation. And not only that, it's like we think in terms of the rapport that you develop with that driver, the extent to which you have the same driver, and in volunteer driver programs, you're likely to have that same, or community transit programs, you're likely to have that same driver. And we talk in terms of the journey being much more than getting from point A to point B. That could be also the only level of meaningful part of socialization that the individual might have during that day. So transportation really, it has the opportunity to do a lot more. So why is dementia a concern for transportation? So here's a chart, a table that might be difficult to read. And in the first column, I have what had been the actual 10 warning signs of Alzheimer's or a related disorder. And in the next column, I have what the effect might be on critical driving. But in the last column, and that's the one I want you to focus on now, is how it might affect transportation options. So clearly, and this is something that we have in a chapter on community mobility and dementia in a healthcare professional's book. Memory loss, which is like, hallmark of dementia. So it's like you might not, in terms of transportation options, you might not be able to remember the actual, the ride time that you're going to be picked up for an appointment. You may be unable to communicate directly with the driver. You actually might get concerned if you see the driver taking a different route. That might trigger, some anxiety in you as well. So it's like we thought through what those examples might be in terms of the transportation option. So the prevalence of dementia in older Koreans, and we've shared data on this. Here's yet another source. So you have from 2010, where it was about close to 9%, all the way projected to 2050 at about 15%. So you could see that that this is an issue, a challenge, that this is the time to really be able to try to think through what those transportation options might be. And as I've said, that when I'm thinking about types of supportive transportation, I'm thinking from arm through arm or hand through hand, that you're actually, halting the person, all the way to the kind of driver training and sensitivity. I mean, even with the Uber drivers or the rideshare drivers that you have, maybe in the profile, if we could start to say what type of vehicle, like maybe a sedan is better than an SUV, or is that driver willing to be able to get out of the car and actually help the individual, to that kind of assistance. There might be drivers that are willing to do that, put it in the profile, and that might be something that would be helpful to an older person. And then I talked earlier, but some vehicle features that promote safety and comfort are also things that are helpful in transportation options as well. The large message here is that the impairments in critical driving skills that impact an individual with dementia in terms of their driving, those are likely to be the same reasons why you can't just stop driving and negotiate public transit. And that's why these strategies are needed to be more age-friendly and then also dementia-friendly. So what factors would help make transportation age or dementia-friendly? And this is where I want to share with you the 5 A's of is the program, is the service available, acceptable, accessible, adaptable, and affordable. And now I'm going to go into examples of what these 5 A's might be. So in terms of availability, here's just some examples of what it means for, looking at a program and finding out, well, how available is it? Does it make multiple stops? Does it do that kind of trip chaining that I was talking about? Will it pick up passengers at their door, or does the person need to go to the curb? Does it offer services, transportation services in evenings and weekends? I mean, in the United States, transportation used to be, and still is in many places, community transportation offered by senior centers, councils on aging in the community, only till 3 o'clock in the afternoon and not available on evenings and weekends. Well, there's clearly more to life than, that people want to do in the evenings and the weekends. So how available are these programs? And will it provide the type of assistance that I had just mentioned to you? Will it provide that kind of assistance? So when I'm looking at how available a program is, we're thinking about addressing some of these challenges. So acceptability. Does the transportation program actually go to where the older person wants to go, needs to or wants to go? And will it go to these destinations at different times during the day, after 3 o'clock, on evenings, on weekends? How clean is the vehicle? How long do I have to wait? Now, in Massachusetts, I can speak to one paratransit program called The Ride. There could be 15 minutes on either end that the driver will wait. Well, if I have dementia, I'm not going to, and I'm told that the driver's going to be there and they're not there, and if I wait, I might wander off. That's not going to be acceptable in that kind of situation. How difficult is it to schedule? Do I have to do it 2 days in advance? Does it have to be longer? Can I schedule something that's closer to an on-demand kind of way? So all these kinds of things are how acceptable is it? And are the drivers trained to be sensitive to to challenges related to aging? Accessibility. Now that you probably are more familiar with in terms of persons living with disabilities, and also because in the United States we have our ADA, Americans with Disabilities Act, and so programs are actually legally mandated to provide accessibility. But how accessible are these transportation programs for other challenges related to aging? Will they help me carry packages? Will they help me in and out of the chairs? What about in and out of the vehicle? And that's where I think about in terms of autonomous vehicles. If I need help getting into the car or getting out of the car, how is an autonomous vehicle going to work in that situation? Adaptability. And actually, I was also thinking, years ago, I was thinking when I first saw these demonstrations, well, what if you're blind? What if you have another disability? How is that going to work? But I'm sure that there's technological solutions to this, but those are the kinds of thinking that I would hope would go into that kind of planning. Adaptability. Will they offer door through door? Will they provide, what about passengers with pets? Okay, will the transportation programs be able to accommodate a passenger who brings on a pet, not necessarily a service companion, but an actual pet? Maybe they need to take their animal to the veterinarian. And what about linking passengers with other services? Now, a lot has been talked about in terms of the microtransit and the last mile. Like, how do you get the person connected to the train, to the airport, to another transportation program? And what about special destination services? What if I wanted to go to the cemetery? Is there a program that's going to take me to the cemetery to visit the grave of a spouse or anyone else? What about affordability? So here's another A. Maintaining and operating vehicles, offering reasonably priced transportation services. Now, I understand here in South Korea, is it true that persons over age 65 are able to ride the bus free? Is it all transportation, the subway too, and everything? Yeah. Well, that's great. That really is great. But yeah, no buts. That's wonderful. Yeah. Okay, so transportation that is age and dementia friendly benefits the older person, their family, their caregivers, and their communities. It's it's a summary statement that I believe. An example related to, I'm going to share a current example related to technology and community transit. So in rural Massachusetts, we were asked to look at for a regional transportation program that is responsible for 23 communities. We were asked to look at 14 of their communities and to try to get these communities through the use of a software program and iPads to try to help with their coordination. So the research question was, and the name of the software is called My Senior Center. Now, My Senior Center is already a program that's in a lot of senior centers, and it monitors the types of activities that people go into. So they're already used to using this software, but we've added transportation, dispatching, and other aspects related to this this software. So we wanted to know, how does the use of this software for coordination and partnership with the Regional Transit Authority, how does it increase the number of older people served by the senior transportation? And also, the extent to which these 14 communities would actually work together and coordinate. So one of our, more and more of our gerontology doctoral students are using GIS, the mapping, which I think is pretty cool. So we asked them to look at these communities, and I'm not sure that all 14 are represented there, but to just show where these destinations in this regional area, where they're driving people. And this shows you can see a lot of overlap in terms of the dots for these different programs. And then I asked can we categorize them using my survival, maintenance, and survival, maintenance, and enhancement, and enriching kind of destinations. You know, what types of destinations were they going to? So as you could tell, the gray bars are those life-sustaining. So those are the ones that these programs themselves would call essential. But then as we get to the blue, the life-maintaining, that would be like going to the bank, going to the post office, to the life-enriching, although we are seeing, life-enriching was showing up a little bit higher in certain areas, and I was surprised by, but some of them were already doing that. And then we asked about, we tried to use this mapping to look at coordination opportunities. Now what we found is that even though we presented to them that there are areas where they could be sharing, maybe it would take a little bit more time for some people, but there could be opportunities. Trying to deal with the turf issues that these communities had with their programs, it's like the older person in my community is used to dealing with this one agency, and and I know that when I call, I'm going to get my program I'm going to get to the driver I want and everything else. So they're kind of entrenched, and it's going to take a while to try to get them to trust that they could use transportation from another community. So it was more, and also there was reluctance on the part of these community agencies to even want to coordinate, because if I give up a ride if I give a ride to another community, and then one of my people wants to use a ride and I no longer have it, I'm holding off on doing that. So there's, as much as in the morning we were talking about the stakeholders and the politics associated with that, the politics associated with very local levels and the feelings that they have about their community agencies and community programs is a hard nut to crack as well. So, that whole communication and trust, and where things might really look good on paper, it's going to take a lot to work through. So another area, this is mobility and the potential loss of participation in society is a public health concern. Alternative transportations must be embraced by public policy. That seems like a obvious kind of statement, but I think it's a very powerful one, because almost 3/4 of the older adults in the United States live in areas with few, if any, transportation alternatives. And I think that that's true globally, particularly when we're talking about the rural areas. So, call to action. United Nations, among their Sustainable Development Goals, 11.2 is, by 2030, we will provide access to safe, affordable, accessible, and sustainable transportation systems for all, improving road safety, notably by expanding public transit, with special attention to the needs of those in vulnerable situations, women, children, persons with disabilities, and older persons. That was 2015. And we're not there yet. So it's like this area is it's so important that people like you really, as you're doing your research, you also add this dimension of the impact on the older person. That I want you to know, it would be great. Any contributions you can make in this area are greatly, greatly needed. And again, I acknowledge our gerontology PhD alum, Bon Kim and Jay Lee, for their assistance in helping me with this presentation. And Gam Sahab Nida. Any questions?